My name is Andrew Kolodny. I'm the director of Physicians for Responsible Opioid Prescribing, and I'm very glad to be here today with all of you, and thank you for coming despite the weather. What brought us all here today, this epidemic of opioid addiction, is not new. It started about 20 years ago, and every year for the past 20 years, we've set a new record for the number of Americans dying of drug overdose deaths. And then the very next year, we've broken that record. This epidemic has continued to worsen over the past 20 years. And we know what's causing this epidemic. We know why overdose deaths are skyrocketing. We know why heroin is flooding into communities across the country, why rates of infants born dependent on opioids is increasing, why we have hepatitis and HIV outbreaks. We know what's causing this. The driver is a severe epidemic of opioid addiction that has been caused by overexposing the US population to opioid painkillers.
Yes.
We also know what needs to be done to bring this problem under control. What we need to do for the opioid addiction epidemic is the same thing we would do for any disease epidemic, whether it's measles or Ebola or HIV. The way you bring epidemics to an end, two things. You contain it. You prevent new people from getting the disease, and you see that people suffering from the disease access treatment so that the disease doesn't kill them. There are different things we can do to prevent new cases of opioid addiction, but the most important thing we can do is to get the medical community to prescribe more cautiously. They have to prescribe more cautiously so that we don't addict our patients and so that we don't indirectly cause addiction by stocking people's homes with a hazard. To bring this epidemic to an end, to bring it under control, the CDC has been very clear. The CDC has been saying we may not be able to control this problem until the medical community starts to prescribe more cautiously, until we see a reduction in prescribing of opioid painkillers. But the drug companies that make opioid painkillers don't agree with the CDC. So the CDC is saying we have to reduce prescribing less painkillers. The drug companies are saying we need more opioid painkillers. They're saying that we need more opioid painkillers because millions of Americans are suffering with chronic pain. They're saying don't penalize the pain patients for the bad behavior of the so-called drug abusers. They're saying that we can bring this epidemic under control by making the pills harder to crush and by telling Granny to lock her medicine chest. But what about Granny? We know that the overdose death rate is highest and has increased the greatest in older Americans. The experts are telling the FDA we don't need more painkillers. They're telling the FDA that we're hurting more pain patients than we're helping when we put them on long-term opioids. The FDA's own expert committee voted no on Zohydro, and FDA approved the drug anyway. They didn't listen to their experts on Zohydro, and now they've decided to stop bringing decisions to their own expert committee. for their OxyContin for Children decision. They completely bypassed their expert committee. They thought that they could approve the drug. They didn't even ask addiction experts about the increased risk of addiction when you expose a child's brain to a highly addictive drug. And don't think for a second that the approval of OxyContin for Children was about seeing that children with cancer pain could access OxyContin. That's not what it was about. Children with cancer pain were already receiving OxyContin, and appropriately so. That decision is about giving Purdue Pharma a green light to promote use for children as safe and effective, children with any type of pain, for any duration of use and at any dosage. That's what that decision has done.
Shame on them. Shame on them.
Many of us who are here today are involved in efforts in our communities, in our states. We've been involved in passing Good Samaritan laws, involved in seeing that there's better access to Narcan to reduce overdose deaths. We've been working on expanding access to treatment. We have people like the chief of police from Gloucester, Massachusetts. We're working very hard on a local effort to do what we can. The reason we're here in Washington today is because the federal government is not doing its part. The Chicago Tribune reported this morning that in the past 72 hours, there were 74 overdoses. This is a public health emergency. It's happening across the country, and it's being ignored by the federal government. If there was a natural disaster, the federal government would be coming in. FEMA comes in. Hundreds of millions of dollars are made available to communities in the wake of a natural disaster. What we're dealing with is a man-made disaster that's being ignored by the federal government. President Obama came into office in 2008. The epidemic was already underway. He had nothing to do with causing this epidemic. But since he came into office, it's gotten much worse. And between 2008 and 2013, we've had 124,000 Americans die of an opioid overdose. Up until 1 week ago, he had never once even spoken about this problem, which reminds many of us who are old enough to remember the way Ronald Reagan remained silent about the AIDS epidemic. And why did Ronald Reagan say nothing during the AIDS epidemic? Because the populations affected by that epidemic were stigmatized groups. And it's the same reason why the federal government has been ignoring the opioid crisis. It was Fed Up rallies across the country on August 31st, and it was the letter we sent the president that probably got him to speak about this problem 1 week ago. But as Judy Rumler mentioned, we need him to continue speaking about this problem, not just to raise awareness, but the more he speaks about it, the more he's on the hook to do something about it. And it wasn't until last year's rally, when we marched to the White House and demanded action from the Obama administration. It was after that rally was the first time since President Obama has been in office that his budget sought funding for the opioid addiction epidemic. We're having an impact, but the amount of money for addiction treatment that was in that budget was so small it was insulting. It's like trying to put out a fire by spitting into it. We need serious resources put into this problem. What we need from President Obama, aside from putting resources, he can do something about the FDA. The head of the FDA serves at the pleasure of the president. The FDA can see that the president could see that the FDA begins to coordinate with other agencies instead of making the problem worse. we're having an impact, and there are many different reasons. I think the one thing that's probably, if I had to pick one factor that's having the greatest impact on turning this epidemic around, it's people who've been affected by this epidemic, who have loved ones who've become addicted or who have lost loved ones and are speaking out about it. That's what's having an impact. It's the brave parents who are putting the real cause of death in obituaries and who are joining our efforts because they refuse to let their loved one's death, they refuse to have lost a loved one needlessly. They want to make something meaningful come from this. We are not going to remain politely patient while the federal government considers this problem and moves slowly. We are going to continue to demand action because we are fed up. Thank you.